Gum disease, also referred to as periodontal disease, is a prevalent dental issue which affects millions all over the world. The cause is the accumulation of plaque on teeth that can lead to infection and inflammation of the gums. If not treated, the gum disease may progress into more severe conditions like bone loss or tooth loss. In this short video, we'll explore the research of gum disease treatment as well as the methods and procedures employed to treat the condition efficiently. 1. Understanding gum disease, causes, and symptoms. Before we get into the options to treat gum disease, it's crucial to know the cause and signs of the condition. Gum disease is usually a result of bad oral hygiene practices like frequent flossing and brushing, in addition to smoking, as well as certain medical conditions like diabetes. Gum disease symptoms are swollen, red, and bleeding gums, along with poor breath, loose teeth, and bad breath. 2. Professional dental cleanings. One of the most efficient methods to combat gum disease is to undergo the use of professional dental cleaning. In a dental cleansing, the dental hygienist can take away tartar and plaque accumulation from the gums and teeth that can stop the progress in gum diseases. Along with getting rid of tartar and plaque, the process of cleaning your teeth can aid in identifying any warning signs of gum disease and address them prior to when they get more severe. 3. Scaling and root planing. In more severe gum disease cases, the procedure of scaling and root planing could be required. Root planing and scaling is a thorough cleaning process which involves scraping the tartar and plaque from the surface of the teeth as well as the roots of teeth. The procedure is able to minimize inflammation and infections in the gums as well as preventing further harm to teeth and gums. 4. Antibiotic therapy. In certain instances, there are instances where antibiotics can be prescribed for gum disease treatment. They can lessen inflammation and infections in the gums as well as eliminating the bacteria responsible for gum disease. The majority of antibiotics are used along with other treatment options like scaling or root planing, which can help increase the efficacy of the treatment. 5. Surgical procedures. If there are severe instances of gum disease, surgery might be required to manage the problem. There is a myriad of surgical techniques that could be utilized to treat gum disease, such as flap surgeries, bone grafts, and controlled tissue regeneration. These surgeries can decrease the size of dental pockets and also repair tissues or bone that has been damaged within the gums. 6. Ongoing maintenance. After gum disease is addressed, it's important to keep up with excellent oral hygiene practices to avoid the problem from returning. It is important to floss and brush frequently and going to the dentist regularly for appointments and cleans. The dentist might also suggest applying a mouthwash or any other dental products that can help keep gum disease at bay. Gum disease can be a frequent dental issue that could have grave consequences if it is not treated. If you are aware of the reasons and signs of gum disease and the many treatments available to you, you are able to take proactive actions to safeguard your dental health. If you think there is a possibility of gum disease, it's essential to visit your dentist as quickly as you can to get the proper treatment. Always remember that prevention is more effective than treatment in the case of gum diseases.